Hey guys, my name is Mavi and I've spent the last 14 years in the plastic surgery and beauty industry, working alongside top board certified plastic surgeons.
Now I'm an independent patient coordinator who doesn't work for any surgeon. This means I have unbiased reviews for hundreds of doctors and I can help you achieve the look of your dreams, whether that's a supernatural or a video vixen. I use my professional and personal plastic surgery experience to help you look and feel your best.
Join in on the fun as I talk to plastic surgery experts, friends, and real-life patients about all things plastic surgery. Should be fun. Hey guys, do I have the episode for you today? I'm bringing back a fan favorite, Dr. Andre Marshall out of Beverly Hills, and we're going to talk all about tummy tucks. Thank you for being on the show, Dr. Marshall.
It's a pleasure. Thanks for having me back.
I'm so excited. I know you're a fan favorite because all of your episode is very, very popular. And I hear in my DMs all the time, oh, I found Dr. Marshall. I heard him on your show. I went to see him. He did an amazing job on me. Thank you so much. So I love hearing that.
Well, thank you. Thank you. I really appreciate the support that your podcast has provided over the years. And it's only going up and up and up. And I love to see it.
Thank you. Thank you so much. So today I thought, you know what? Tummy tucks are such a big part of what we do, right? Mommy makeovers, abdominoplasty is like number one. So, but it's also very misunderstood. Who's the right candidate for what? So I thought today would be a good idea for us to really go into the different types of abdominoplasties and who is a better candidate for what. So I hear so many times, and I'm sure you see it in your practice with your very thin moms or moms who aren't very large, who think that all they need is a mini tummy tuck. But in reality, they're a better candidate for a regular tummy tuck, normal tummy tuck. So why don't we go into like the different abdominoplasties and who's a good candidate for what?
Yeah. Let's just start off with what is an abdominoplasty and what is that definition? Removing the excess skin, in the lower abdomen, that constitutes, one of the foundations of abdominoplasty. And then muscle repair. We talk about, you may see the term MR, diastasis repair. Basically, once those kids have stretched your abdominal wall out, that muscle becomes separated. And not just the muscle becomes separated, but the fascia that holds the muscle together becomes loose all around. So the goal with any abdominoplasty is to tighten the core and bring those muscles back together and to tighten that fascia. To do that, you need wide exposure. You sometimes need to get all the way up to what's called the xiphoid or the breastbone. And we start the muscle repair from all the way up near between the breast, all the way down to your pubic bone. With the standard abdominoplasty that most people get, we're talking about removing skin from the top of the belly button all the way down to the pubic area, usually where the hair starts to grow. With that much skin removal and that much elevation of the skin, we can tighten the entirety of the muscles. With that, though, does come what's called, a transposition or moving around the belly button. The belly button stays the same. It's the same skin from that you've kept all your 20, 30, 40 years on this earth. But once we pull that skin down and close everything, we make a new hole and bring that belly button up through that hole. And that's just the standard traditional abdominoplasty. That usually goes hip to hip, and you see that scar that usually sits nice and low in your bikini line, as it should. We could talk about the variations of some people put really high scars that are visible,
I think that's a really good, let's finish this thought and then let's go into the different variations of because I know my girls are so curious about how come some of them are in the shape of a V, how come some of them are in the shape like they go across. And that's a really good topic for us to touch on.
Absolutely. So that's just basically a standard abdominoplasty. I think what many people think is they want a mini because they think it's a smaller scar. And that's not always the case. A mini just implies that you're essentially not touching the belly button. You're not moving it around, and you're just removing whatever skin kind of hangs over. So when you're sitting down, you may see a little bit of extra skin that, kind of folds over in your lap. And where that delineates or where that kind of stops, that's what is being removed with a mini abdominoplasty. Could you do it with a small scar? You could, but sometimes as you keep that scar shorter, you end up with dog ears or extra skin on the side. So there are people who've had mini tummy tucks, but that scar is just as long as a regular abdominoplasty because you don't want to have dog ears when it's all said and done. Outside of that, I would say what I more commonly do is something called an extended abdominoplasty, and that's where the scar actually wraps around to, around the flanks or the hips and doesn't go all the way like a 360 or circular tummy tuck, but does go back further than standard because number one, it helps prevent dog ears. Number two, a lot of people who have lost a lot of weight or have a lot of, I guess you would say, extra skin from, a lot of flank lipo, they'll have that extra skin along their flanks, and that has to be removed. Otherwise, you're going to have dog ears. And I think dog ears are the most costly mistake somebody could make during a tummy tuck.
Another thing that I often get asked about, and I would love to hear your thoughts on it, is the floating belly button.
Mm-hmm. Yeah, so the floating belly button, you got to be careful with that one. So basically, in that situation, you've lifted up the skin and you're not going to make a new belly button. You're just going to pull down the skin and the belly button's going to get pulled down with it. People who are candidates for that, that's typically can be done in a mini, but it's good for people who naturally have a high belly button. So people say, where should my belly button be? If you were to stand up and put your hands around the top of your hip bones and grab and bring your fingers together, that typically is where your belly button should sit on your hips. So if you put your hands right on top of your hips and bring your fingers together, that is where, in the mirror, standing up, that is where your belly button should sit. If your belly button is at that level or lower, I do not recommend floating it. Now you're going to have a belly button that's pretty much close to your scar. If your belly button is higher than that by a couple of centimeters or inches, then yes, you are more of a candidate for a floating belly button. Why would someone float the belly button? Because they're trying to avoid that vertical scar that you often see in people who have a tummy tuck, and they don't want that anchor type scar look because they don't have enough skin to pull all the way down. And so a lot of surgeons, including myself, have to leave a vertical. By doing a floating belly button, you avoid that vertical, but then you end up with a belly button that you can't even see when you're wearing your normal underwear. So you got to be careful.
I 100% agree with that. So now let's go back to what we were just talking about the different incision types, I guess, the different ways that surgeons do their tummy tuck incisions, and why would somebody choose one versus the other?
Uh-huh. Are you kind of referring to like
Like,
sometimes the scar is like straight across, and then sometimes it's like it goes up like this? Okay,
and
that's a
sometimes
good
it's
question.
like a V. It's
Yeah,
like it
yeah.
follows up. It looks like an underwear line, kind of.
I always tell patients, plastic surgeons, we're not all the same. We could go to the same institution, the same schools, and we're still going to do our work differently. If you put 7 artists in a chair and tell them to draw a banana, there's no question that they're all going to look like bananas, but they're all going to have a different flavor and spin on however they drew that. So, the standard thing is you definitely, with any tummy tuck, you want what's called a pubic lift. If you have a sagging pubis area or mons pubis, you want to bring that skin up. And so typically what we say is you want to put that scar anywhere between 5 to 7 centimeters above the very, very top of that crease that's there in your pubis. When I typically make my incisions, I typically come across and then I look at the hip bones themselves because the hip bones kind of determine what kind of underwear a lot of women wear. And so, but my goal is that when you're wearing a standard bikini, whether it be from Victoria's Secret, Shine, Shein, or whatever it's called, or whoever, I want that scar to be hidden. And so, if you look at some women, they have low hip bones, some women have high hip bones. And so, my goal is to follow the curvature of those hip bones so that any underwear you wear or bikini should be well covered. There are some people who just make a scar straight across and then they pull the skin straight down and they end up with a scar that's straight across. Technically, there's nothing wrong with that, but when they wear a standard pair of underwear, they have parts of their incision sticking out on either side. That to me is not an aesthetic that I go for because I don't want people to know you've had a tummy tuck if you're at the beach. So it's all about surgeon preference and a lot of times how they were trained on how that scar goes. The height of the scar, some people have a scar that when they wear underwear, it's sticking out of their underwear. That's usually due to surgeon comfort. Surgeons will place a scar higher to avoid a vertical incision after they pull that belly button down. The more comfortable a surgeon is with, a lower scar and getting that skin removed, that scar should be, more well hidden. So it all comes down to surgeon preference, surgeon technique. I actually have patients bring a pair of underwear in the morning of surgery to mark them exactly. So bring your favorite pair of Vicky's underwear, and I'll mark exactly where your underwear line is. So I try to keep that scar where it should be.
I love that. I actually, when I talk to my girls, I always tell them, take a marker with you to your consultation
Mhm.
so you can ask your surgeon, can you show me where my incisions will be or where you planned for my incisions to be so that I
Mhm.
can go home and look in the mirror and see before I make my decision, am I okay with these scars? Am I okay with where this is going to be? Am I happy with this location? And that also, one of my other recommendations is bring your favorite pair of panties or your favorite bikini to your surgeon and
Mhm.
ask them to keep your incision within that line. So I love that. What are you recommending for your patients as far as post-op care with
Mhm.
massages? How
Mhm.
soon do you allow them to get a massage? I think it's very interesting how each surgeon is different with when they allow their patients to start getting lymphatic massages. My
Right.
question is, do you let your tummy tucks get massaged and how soon?
Yeah. Okay. Yes, I like it. That's also a very controversial thing. So first off, I'm team lymphatic massage. With just lipo or lipo BBL, we start on day two, not day one, day two, and typically do about 2 to 3 massages a week. With tummy tucks, I do lipo just the same as I would without a tummy tuck, and so I usually have them start on day 2 or 3, and the massages are typically occurring only on the back and the flanks. I don't allow any abdominal compression or manipulation for about the first 3 weeks. A couple of reasons why is because those sutures holding the belly button together are pretty sensitive. I can't control for every masseuse, and if some people just go in there and start really going at it, they could disrupt those belly button sutures. The same with the abdominal incision. My sutures are pretty strong, and so most people can't rip those apart. But I usually just prefer to stick to the sides and to the back and or arms if I lipo the arms with a tummy tuck. But yes, at 3 weeks they can start massaging the abdominal area.
Hey guys, do I have the show for you today? I am super excited and honored, I feel, to have Dr. V on the show today. And if you guys follow him on Instagram, you might remember him for being a master of the natural appearing tummy tucks. That I was binging your Instagram before we started today, Dr. V,
No,
and
thank you.
beautiful,
Thank you.
beautiful
Thank
work.
you. I really appreciate it, especially coming from you. Yeah. Before we started, you were telling me about your journey and what has driven you and motivated you to do what you do. And I have to tell you, and we are all very grateful for all the help that you're providing to patients and you being an excellent resource and source of education. And you're doing great work. So I really appreciate it. I'm honored to be in your podcast.
Thank you. Thank you. I do it with a lot of love, which I'm sure
Hmm.
you do your surgeries
Of
with a
course.
lot of
Yeah.
love, and we can totally tell. So, something that I really loved about your feed is your mommy makeovers. So, I would love for you to, that's probably the top procedure I hear
Yeah.
about. And the second part of that is a mommy makeover combination procedure where you do an abdominoplasty and a VBL at the same time. So I would love to hear from you, how you do your patient selection. What do you do differently that makes your tummy tuck so beautiful and that belly button so perfect?
Yeah. So first of all, mommy makeover is a really, really, really great procedure because it's not just the aesthetic component; it's also the functional component. It's the well-being component. It's really women after have given birth, have gone through pregnancy, have seen alterations in their anatomy, alterations in their bodies, in their physique, their ability to exercise. So mommy may also the appearance of the breast, the engorgement of the breast during pregnancy, and then the deflation after pregnancy, breastfeeding potentially. All these factors really, really, really affect women. So a mommy makeover procedure, or if broken apart, tummy tuck with liposuction and a breast lift and Other community like adding implants, adding fat to the breasts, the degree of liposuction, all this is really, really, really not just a cosmetic procedure, but really a functional procedure that aims to improve anatomy and help women get over and feel better about themselves, wear clothes better, improve their self-esteem and overall well-being. And we see that case after case, patient after patient, woman after woman, and they feel better, they look better, they come with a smile, they never, almost never regret it. And it's just an honor to be able to do that surgery. So, and then, yes, combining it with BBL or fat transfer to the breast, it's not for everybody for sure. Number one, it's for women who have not really nice skin envelope. Okay, because when you add fat to the breast, you have to anticipate a degree of predictability. Otherwise, you really cannot predict results. So you need to make sure that when you inject the fat actually, kind of stays where you're supposed to be. They don't see, you have to predict the changes that you will see through time, years, 2 years, when the skin envelope that's not very tight because of weight loss, weight gain, because of pregnancy changes with the hormones, the elasticity changes. So you have to take all these factors into consideration. So when you add the fat, there is a sense of predictability, sense of accuracy, and you're not surprised by the outcome. And also, women need to be on the same page and understand the anatomical, I would say, challenges as well as differences in that patient population than, let's say, somebody else who's a little younger, who's never had children. And also, very important, be able to go through the recovery process, because when you recover from a tummy tuck, it's challenging, but recovering from a tummy tuck and BBL is a little extra because you have to protect that fat. So when somebody's on this, is ready, committed, understands all that, then yeah, it's a good candidate for that procedure.
I love to hear that. I have a question that I get all the time in my DMs. How much fat is going to stay? So, you having all of the experience that you have in doing BBL fat transfer and breast transfer, do you find that the percentage of fat that stays is the same for like the both areas, or are they different?
Transfer to the breast for sure. There's definitely less survival. What I tell my patients is the fat transfer to the breasts is more of a contouring procedure, not a breast augmentation procedure. Fat transfer to the breast is not to replace an implant or in place of an implant or a substitute to an implant. Breast augmentation to the breast will achieve half to one full cup size increase. The only time I've had more than that in essentially fat transfer to the breast for augmentation purposes was a lady from California. We increased her cup size by 1.5. That was the most success I ever have. Usually is about 1 cup, but I tell the patients half cup is possible, and they might need more rounds of fat transfer to get them to a more satisfactory result. But I use most of my breast lifts are now done with fat transfer. Great improvement in terms of the contouring, the cleavage, as well as the upper pole. Great transition between the chest and the breast. Cleavage is great after fat transfer. We see great results there, and the survival is totally acceptable, but definitely not a replacement for implants. I tell this to all my patients.
When somebody is considering multiple procedures, do you find that they save money by doing them in a combination procedure?
They save money, but most importantly, they save recovery time of work. Um, in the psychological burden of actually recovering from major surgery, it's better to go through it once than keep going through it. Now, not everybody's a candidate for combination procedures. Not everybody can have all their desired procedures in combination. That's very common in weight loss patients. Um, you have to be reasonable, but knowing that when a surgeon feels confident that they can do the procedures in combination equally to to the same standard if they did it individually, my recommendation is to do it combined, provided of course it's safe. That's a given.
Hey guys, do I have the show for you today? You're not going to believe who I have on the show. I have Dr. Jerry Chidester. He goes by Dr. Chitty. You guys probably have seen him all over the internet dancing and educating and just doing the best that he can do. Thank you so much for being on the show, Dr. Chitty.
Thank you so much for having me. It's been a long time coming.
It really has. You know, you really caught my attention on TikTok, and it was mainly because of your mommy takeovers. I would love for you to go into tell us about how you came up even with calling it a mommy takeover, and what do you see in your patients?
Yeah, so the mommy takeover goes back. So I practice in Salt Lake City, Utah. I'm a board certified plastic surgeon, and a lot of the population here in Salt Lake City and the surrounding area are women who have either recently had kids or in the middle of having kids or done having kids. And they're in their 20s to mid 40s typically. So a lot of my patients are in that kind of mommy age range where they're raising their kids still, or the kids are a little bit older. So because I do so many like mommy makeovers, I all my patients are female pretty much. I do have some male patients, but mostly female. And one thing I've really noticed with these surgeries is just how empowering it is for women to really get their bodies back, to kind of take back control of their body. So I said, I feel like the word makeover, although it's fine, and we hear that all over the internet and social media, I feel like it's not as empowering as someone or woman who's taking control of their life back, taking back their body. So that's why I started calling the mommy takeover, and it just kind of stuck. And so my patients call it that. And I just love that because, this is something we're able to help women with it. They just can't do on their own when you have that loose, stubborn skin, that scarred fat, the wide muscle separation. And those are things, no matter what they do in terms of exercise, diet, it's never going to repair itself. And I think one thing I try to do on social media is really help people understand that, and kind of break those stigmas down. Like, hey, you're not copping out if you decide you want to do this mommy takeover. We're just doing something to help you out. And to see the confidence that women have after the mommy takeover, it's just so gratifying and rewarding for me as a surgeon, our team, and our patients.
Dr. Chitty, that boost of confidence is what led me to launch this show and led me to believe, hey, I have something important to say. I have information I can share. And I shared it with my audience how it was not that before I had my surgery, I was already working in plastic surgery and I had all the knowledge, but I didn't really have the confidence in myself to believe, hey, I can do it. And it was after my surgery and going through the whole process and seeing how much information there was lack of online, it led me to like, you know what, I can do it. And I'm so thankful because and I'm sure you have seen the amazing transformations in women's and just how their lives just take off after surgery.
Yeah, no, for real. And it's cool that you have that personal experience that you can relate to your audience and to other plastic surgery patients. And I agree with you. There's a lack of information out there. The problem is there's a lot of information that's either incomplete or misleading. That's a lot of times not generated by even plastic surgeons, people who, just aren't a part of the field. But so it's really important for us, I think, as educators to, share those experiences and help people better understand. Again, like I said, break down the stigmas of plastic surgery. We hear that and we just think, oh, it's vanity. Well, for one, if you're doing it for a vain purpose, so what? That's up to you. It's no one's place to judge you. But two, there's so much more than that. It's the functional aspects, like you talk about, the confidence even that you have after the surgery, and what it's able to do for people's self-esteem. And so it's just really cool to see those changes. And people that don't know about it, they don't know the benefits you can get. If there's a really good restaurant down the street and you never heard of it, you'll never be able to experience that, but people go there, they love it, and they start sharing about it, and you hear word of mouth, and then you experience it and you want to share it, And so I think that's where the mommy takeover and plastic surgery is headed, in my opinion. I've seen that change over the last 5 years of being in practice, just social media being a good tool for surgeons and other people to help educate the public.
I love it. I love it. And you know what? Let me tell you another thing that caught my eye. Your belly buttons are chef's kiss. Why don't you tell us a little bit about how do you decide what the belly button's going to look like? to educate our audience on how the belly button looks, how you decide, I guess, how you decide how it's going to look, how they can look at belly buttons and make some conclusions.
Yeah. So, thinking about abdominoplasties is something, we obviously all learn in training. And there's so many different techniques of how to create a belly button. And a lot of people think, one, we just cut off your belly button you were born with and then make a new one. And we do that sometimes. Like I did that yesterday, actually. But for the most part, we're actually saving your belly button stock. We cut around it, we pull the skin down, and then reshape the belly button. And so for me, when I first started doing it, I was doing what I learned in training, but I realized pretty quickly, like we're trying to take like someone's belly button, like they had it their whole lives, and then change it to make it look like everybody else's belly button that you're doing, and it's like, I didn't feel like that was natural because I felt like we're trying to take a square and fit it in a circle, for everyone. It's like if you have a hammer, everyone's got a nail, but some people have different shaped belly buttons. And so when I look at a belly button, I've kind of evolved how I do it because I spend a lot of time. I spend about 30 minutes in each surgery of a tummy tuck. And tummy tuck takes about 75 minutes, and 30 of that I'm spending doing the belly button. Because in the end of the day, you can hide your tummy tuck scar under your swimsuit or your bikini, but you can't hide your belly button. I mean, you can just cover it, right? But really, like, I think the best types of tummy tucks that you can get that is when you're willing to show off a belly button. So for me, it really comes down to, one, what does your belly button look like before surgery? And some women's belly buttons, they're like, I don't like it, right? They're like, I don't like my belly button. It's stretched out from pregnancy. They might have a hernia, so there's a little, stuff poking through, or it's just stretched out, or it's really long because maybe they gained a lot of weight and lost it during pregnancy. So there's all these factors I look into. I'm actually in the middle of writing a paper on it to publish in a journal. So I'm going to kind of publish my actual, like, how I do it step by step. But in the end, I look at their belly button. I ask them if it's the one they like it, or if they want it different. Because some people say, well, I want more of a vertical, or I want more round, so I ask the patients, and then we reshape it during surgery. And so that takes, like I said, 30 minutes. There's a lot of steps for that. But I really think spending the time to do that, like, patients will feel like, they've done something that really helps them look like they did before they had kids.
Absolutely. And those belly buttons, that's probably the number one thing I hear from women who are considering a tummy tuck. It's, I'm scared of having an ugly belly button, or, I'm sure you've seen some pictures on the internet where they have a really big scar around their belly button and just unsightly. And it's something that, it scares them. So to know that you tailor your belly button design to the patient's, what she's looking for, what they have, and what they desire, I think that's really amazing. So I've actually had a few patients who have who had surgery with you and gone through your care, and I've loved how you've taken care of them. Why don't you tell us about what can somebody expect when they come see you, as far as seeing you for consultation? How is the post-op care? Tell us a little bit about that.
Yeah. So it depends, if you're in state or out of state, but essentially we treat you the same in terms of how many follow-ups you have and all that, whether you're in state or out of state. My whole goal from the beginning was, if we were going to start, because of social media and things, just, our reach is across the nation and the world. And so I really wanted to establish care where if someone were to come from New York or Australia or down the street, they're going to have the same level of care and feel like they're being attended to the same. So if you're from out of state, for example, a lot of times patients will actually fly in now for their consult to meet me in person and our team, but that's not required. But what I do require is, if you're coming from out of state, typically I do want to meet you before your surgery. I don't like to show up the day of surgery and say, hi, here we are, because I want to see you, examine you, get all your measurements, make sure everything is what we were planning, but usually we'll do a virtual consultation. I do that like this, face-to-face or in person. I always meet you at the consult. I don't have my PA or, someone else see you for a consultation. I'm the one coming up with the plan with you as the patient. And we decide together what you want to do, what's best for you, and what's safest. So we do that. And then patients typically have a pre-op appointment with my nurse. And that's where I go over a lot of the details, the nitty gritty of all the, the consent forms and everything. And that can typically be a virtual consult if it's out of state, Or again, if I didn't see you at the original consult, then we try to have you, we arrange it so your pre-op is in town, and then I meet you as well. So again, I always meet you before surgery. And then our nurses go through all the consent, we get the photos. If there's any questions that arise or you want to change your plan, then I'll meet you again. Then the nurse will say, hey, you know, they have questions, and then I'll meet you again before surgery, because I want to make sure that your plan is clear to you and that what we're doing is what you want, that you're safe. So then the day of surgery, I meet you, obviously, we do all that. You have your surgery, and then we always do a 24-hour post-op appointment. I always do that. I know not every doctor does it. I mean, that's up to them. But I feel like if you're going to catch anything wrong within the first 24 hours, like that is the ideal time to do it, right? And so I always see it. But, you know, because my schedule, I operate almost every day, so I'm not always in clinic. And the way that, because we don't have our new building yet, where everything's in one space, I operate sometimes in a different city than where my clinic is. So I can't be in two places at once. But we tell our patients ahead of time, we give them a schedule. We say, okay, these are the days you're going to see Dr. Chidester. These are when you see our nurse and our PA, and we cycle. So we see patients at 24 hours, at 1 week. So if I didn't see you at your one day, I see you at the 1 week for sure. So I always see you within the first week, post-op. And then we do like a 3 week, a 6 week, a 3 months, you know, and then annually. And so pretty much I tell patients, if you're my patient, you're my patient for life. You know, I want to take care of you. And so we're always available if you ever need us.
Hey guys, do I have the episode for you today? You guys are not going to believe it. I finally got my surgeon to come on the show. I am so excited to have Dr. Germán Newall, board certified plastic surgeon out of Houston, Texas. Hello, Dr. Newall.
Hi, Mavi. How are you? Good to see you.
I'm doing good. I'm happy to see you too. I am so happy to finally share my surgeon with all of my girls, my audience. They're always asking me, who did your work? Who did your work? Dr. Newall, he's in Houston. Y'all got to come see him. So I'm so excited to finally get you on the show and get to talk about your amazing talent, which I think is combination surgeries.
Thank you so much, Mavi. It's a pleasure to be here with you all and share my experience.
Thank you. Dr. Newall, so I'm going to talk a little bit about something that's a little controversial online, which is combination surgeries. And I've talked about my surgery, which I had a tummy tuck, lipo 360, BBL, all in one sitting. And you did all of that. And you know, as much as I know, how much controversy there is about doing multiple procedures at once and doing a tummy tuck at the same time as a BBL.
Yes. Well, I think the most important thing in any kind of combination surgeries is the issue of safety. We have an extremely safe team. We approach it in a team fashion, anesthesia, surgery, all of that. We take all the precautions necessary to avoid complications such as blood clots, which is the most dreaded complication. We use anticoagulants in all our patients. So we have it down to a science. And I think it's typically a very doable procedure. We do it all the time. It takes me about 2.5 to 3 hours to do the combination tummy tuck, 360 liposuction, and a BBL. And that is a very safe time. So I feel very comfortable doing that operation and have no issues with it at all.
So something that I really love about your technique, and I would love for you to tell us more about it, is that we can sit post-op day one.
Yes. The technique I use is the most advanced technique. It's a roller pump technique, which allows me to put fat in pretty much everywhere in the buttock in a very safe way, from above down, to avoid where all the vessels are that can give you trouble. With this technique, you can sit from day one and not displace the fat that you place. Now, typically, with this technique, you can get a 70% fat take, meaning that of all the fat that I put there, 70% stays forever. And you lose about 30%, which really is the best take there is in the market. So no, I feel very comfortable with this technique. It's safe, and again, the results are outstanding.
You know what? That's something I always talk about on the show about after your surgery. It's either going to motivate you to change your eating habits and change the way your lifestyle so that you can maintain the results, or you
Yes.
don't change and you just continue to live and eat how you were living and eating, and you might not last, your results might not last.
Exactly, and again, I know, and you know it, Mavi. This is not magic. I mean, I can make changes that are beautiful and very desirable, but it's up to the patient to maintain them. I can't do more than that, and I think the majority of patients understand that. But there's a little part that really feel that this is just a procedure to lose weight, and it's not all about that. It's about changing your bad habits and making you look your best.
Exactly. And after you have surgery, like for me, it motivated me to make lifestyle changes to keep so I could keep my results. And let me tell you guys, a
Yes,
few months ago, maybe it was last year, I went in to see Dr. Newell with a friend of mine who was going to have surgery with him. And I showed him a very small part of my incision where my scar is a little bit not thick, but it's just a little raised, but it's the only spot. And you know what Dr. Newell told me? He said, sometimes you don't break what's not broken. And I really want us to talk about that because I feel like there's a chasing of perfection in plastic surgery.
yes.
And I want us to be realistic. And you put me in my place that day. You were like, Mavi, like, you look great. Your incision is perfect. Like, live your life.
Yeah. You know, you touch upon a very important issue. The enemy of good is better. You try to achieve perfection. There's no such thing as perfection. Uh, you got to realize that if you look good, be happy about it, uh, because perfection doesn't exist. And sometimes, like I said, the enemy of good is better. You try to go for that, and you get a complication, and things go downhill.
Exactly. So I've always really appreciated how you were so honest with your patients, and you were always caring about, you know what? It's okay. Save your money. We're not going to go for more surgery. You don't need more surgery. And I've always really appreciated that and admired that about you because it's not something that is a given across the board. And Dr. No, I do want to do a special mention of that beautiful bow tie. And you're always wearing your beautiful bow ties.
Thank you so much, Mavi.
They look great
That's
on you. And if you go in to see him, you're going to see him dressed up in a really nice suit with his really nice bow tie, smelling great, and just going in and turning moms into hotties left and right.
Thank you, Mavi. You're so kind.
Dr. Newell. So if my girls want to come see you, where can they come see you?
Well, I see patients Tuesdays and Thursdays at the post oak office, and just make sure that they can call Patty and Maggie or the answering service, and they can contact them, and we'll take good care of you.
They will. Dr. Newell, I know anybody who comes in to see you, you guys, if you come and you're telling you learned about Dr. Newell on the podcast, tell him Mavi sent me so he knows
That's
to give
right.
you the special Mavi treatment.
Of course, always, always.
Thank you so much, Dr. Newell. It was such a
Thank you,
pleasure
Mavi. It's
to
been a
have you
pleasure
on.
seeing you. It's
It
been a
was
pleasure
good
seeing
seeing
you
you
and
too.
talking to you. You're fantastic.
Thank you, Dr. Newell. And with that, I will see you guys next week. So, if you're listening to this episode and you're listening to the Big Butts No Lies podcast, you might be on your surgery journey. And if you are, and you don't know what to do, you don't know where to start, you've come to the right place. I am so excited to do one-on-ones with you guys. I've realized as I do them more and more just how valuable they are to you, not only because you get my expert opinion, I get to guide you towards plastic surgeons that we know are going to do a good job and keep you safe. Besides all that, I get to talk to you about things that might not even be on your radar, things that you don't even know are possible.
But since we get so in depth with our conversations and I really get to know what your dreams are and what you're really looking for with your body, I can tailor my recommendations to the surgeons that I know can help you achieve that. And taking the guesswork out of who to go to is invaluable. So schedule your one-on-one phone call with me. You can go to my website, go to the quick links, submit your information, let me get to know you, let me see how can we help you. You can get your own team. You guys, I have been working so hard behind the scenes to come up with a perfect way for you to have your plastic surgery and not only come out with beautiful incisions, but also feeling beautiful on the inside. So book your call with me and take the guesswork out of your plastic surgery journey.
And don't forget, new episodes every Monday. I'll see you then.